He drank lemon water every morning for a year. What happened to his kidneys shocked everyone. Every single morning for 1 full year, Raymond did the same thing before he did anything else. Before coffee, before breakfast, before he even looked at his phone, he walked to his kitchen, squeezed half a lemon into a tall glass of water, and drank it completely. Every morning, without exception, for 365 days straight. He had read about it everywhere. He had watched video after video recommending it. Celebrities did it. Fitness influencers did it. Wellness websites called it one of the single best habits a person over 60 could build. Boosts your immune system, flushes toxins, balances your body's pH, protects your kidneys, aids digestion, promotes weight loss. Raymond believed every single word. He was proud of his discipline. He told his daughter about it. He told his neighbors. He told me about it at his very first appointment, smiling, waiting for me to tell him what a smart and healthy choice he was making. What I told him instead stopped him completely, and what his lab results showed when we ran them that same afternoon shocked me. In 10 years of practicing medicine, I had seen this pattern before, but never this clearly, never this dramatically, and never in a patient who was so completely convinced that what they were doing was protecting the very organ it was quietly destroying. Raymond's kidneys were in serious trouble. My name is Dr. James Harlow. I have spent 10 years in internal medicine with a focused specialization in cardiovascular and metabolic health in adults over 50. In that decade, I have sat across from patients who were following advice they found online, advice repeated so many times across so many platforms that it had taken on the weight of established medical fact, and I have had to be the person who tells them that what everyone is confidently recommending is causing them real and measurable harm. Today, I am going to tell you Raymond's full story. I am going to explain exactly what lemon water does inside the aging body that nobody in the wellness industry is telling you. And I am going to give you the specific information you need to make a genuinely informed decision before you squeeze that lemon into your glass tomorrow morning. Please stay with me through this entire video, because what I am about to share is not about fear. It is about the complete picture, the part that gets left out every single time this topic comes up online. And please share this video before you finish watching, because I guarantee that someone in your life is doing exactly what Raymond did every morning, and they deserve to know what you are about to learn. Let us begin. Why lemon water became the most trusted morning habit in America. Before I tell you what went wrong for Raymond, I want to acknowledge something honestly. The popularity of lemon water did not come from nowhere. It did not come from pure marketing invention. There are genuine, research-supported benefits to lemon water consumption that I want to be upfront about. Because this video is not about telling you that lemon water is poison. It is about telling you the complete truth, the benefits and the dangers, the part that applies to everyone and the part that applies specifically and critically to adults over 60. Lemons contain significant amounts of vitamin C, a powerful antioxidant with genuine immune-supporting and anti-inflammatory properties. Lemons contain citrate, a compound that in moderate amounts has been shown in certain studies to help prevent the formation of some types of kidney stones in some patients. Lemon water increases overall fluid intake, which supports general hydration, and the ritual of a consistent healthy morning habit has genuine psychological benefits for discipline and routine. These are real. I am not dismissing them. But here is what the wellness industry consistently and irresponsibly leaves out of that conversation. After age 60, the body processes the compounds in lemon water through systems that have changed significantly from what they were at 30 or 40. And when you take a habit that carries genuine benefits for younger adults and apply it daily at high doses to an aging body with declining organ efficiency, the balance between benefit and harm shifts in ways that can be dramatic and deeply dangerous. Raymond discovered this the hard way so that you do not have to. The first thing lemon water does to your kidneys after 60. Raymond was 68 years old when he first came to see me. He had moved to the area after retirement and was establishing new care. Healthy-looking man, active, non-smoker, moderate diet, no significant cardiac history. The kind of patient you expect to see good numbers from. When his metabolic panel came back, I looked at his kidney function markers and immediately asked him to come back in. His creatinine was elevated. His eGFR, which measures how efficiently your kidneys are actually filtering your blood, had dropped to a level that placed him in the early stages of chronic kidney disease. Not severe, not yet requiring intervention, but concerning, genuinely concerning, for a man with no obvious risk factors for kidney decline. I asked him again in detail about everything he consumed daily. That is when he told me about the lemon water. Every morning, half a lemon, full glass, 365 consecutive days. Here is what had been happening inside Raymond's kidneys every single morning. Lemons are one of the highest dietary sources of oxalic acid, and its related compounds. When lemon juice is consumed, particularly in concentrated daily doses, oxalate levels in the urine rise significantly. In younger adults with full kidney function, this is managed and cleared without lasting consequence. But Raymond's kidneys, like the kidneys of most adults in their late 60s, were operating at reduced efficiency, 30 to 40% below the filtration capacity of a younger adult. This is normal age-related decline, it is expected, and it is almost never detected without specific testing because most people feel completely fine while it is happening. In a kidney operating at reduced efficiency, elevated daily oxalate loads from concentrated lemon juice do not clear cleanly. Oxalates bind with calcium inside kidney tissue and form calcium oxalate crystals. These crystals accumulate, they cause microinflammation, they cause progressive scarring of delicate kidney tubules, and they accelerate the very decline that made the accumulation possible in the first place. Raymond had been delivering a concentrated oxalate load to his already aging kidneys every single morning for a year. His morning health ritual was functioning as a slow and steady assault on the organs he was most convinced he was protecting. A study published in the American Journal of Kidney Diseases found that adults over 65 who consumed high oxalate foods and beverages daily showed significantly accelerated decline in kidney filtration rates compared to similar adults with lower oxalate intake. The researchers specifically flagged concentrated citrus juice consumption as a meaningful contributor to this pattern in older populations. I have seen this in my own practice more times than I am comfortable with, and almost every time the patient is shocked, because everything they read told them the opposite was true. The second hidden danger: what lemon water does to your blood pressure medication. Raymond was also on a common blood pressure medication, amlodipine, a calcium channel blocker prescribed to millions of older adults across this country. Effective medication, well tolerated by most patients, one of the most commonly prescribed drugs in adults over 60. What Raymond did not know, what his previous physician had never told him, what the wellness videos praising lemon water never mentioned once, is that compounds in citrus juice including lemon can interact with the metabolism of certain calcium channel blockers and other cardiovascular medications through a specific enzyme pathway in the body called CYP3A4. When this enzyme pathway is affected by citrus compounds, medications that depend on it for proper metabolism can accumulate in the bloodstream at higher concentrations than intended. The medication becomes stronger than the prescribed dose because the body cannot process and clear it at the normal rate. The consequences of this in an older adult can include abnormally low blood pressure episodes, dangerous dizziness upon standing, falls, and paradoxically in some cases, cardiovascular stress from the body's attempts to compensate for blood pressure that has dropped too far too fast. Raymond had mentioned to his previous doctor that he sometimes felt dizzy in the mornings, lightheaded when he stood up from bed. His previous doctor had noted it and attributed it to normal morning orthostatic changes that are common in older adults. Nobody had connected it to the lemon water he drank every single morning 30 minutes before taking his blood pressure pill. When I identified this interaction and adjusted the timing and monitoring of his medication management, his morning dizziness resolved within 2 weeks. But the kidney damage that had been accumulating for a year did not resolve. That required a much longer and more careful management plan. If you take any cardiovascular medication, any blood pressure drug, any statin, any medication that your pharmacist has ever told you to avoid taking with grapefruit, please have an immediate conversation with your doctor about your daily lemon water habit. Lemon is not grapefruit, but it shares enough of the same chemical family to warrant serious discussion. Do not assume it is safe simply because nobody has told you otherwise. The absence of a warning is not the same as clearance. The third hidden danger: what daily lemon exposure does to your gut and nervous system after 60. There is a third way that daily concentrated lemon water was affecting Raymond that I want to explain because it is the least discussed and in some ways the most surprising. The vagus nerve is the longest nerve in your body. It runs from your brainstem all the way down through your chest and into your abdomen. It is the primary communication highway between your brain and your heart, and it plays a critical role in regulating heart rate, blood pressure, and the electrical stability of your cardiac rhythm. After age 60, the vagus nerve becomes more reactive, more sensitive to stimulation, and certain triggers that a younger body manages without incident can cause significant cardiac responses in an older adult. Highly acidic substances consumed on an empty stomach, which is exactly how every lemon water protocol recommends consuming it, first thing in the morning before food, can stimulate the vagus nerve through the lining of the esophagus and stomach. In most younger adults, this produces nothing more than mild digestive discomfort, if anything at all. In older adults, and particularly in older adults with any existing cardiac conditions, including the mild arrhythmia that Raymond had carried for several years without major concern, Vagal stimulation from daily concentrated acidic intake on an empty stomach can trigger episodes of slowed heart rate, brief blood pressure drops, and in susceptible individuals, moments of cardiac rhythm instability. Raymond had mentioned occasional episodes of feeling briefly strange in his chest in the mornings, a fluttering feeling, gone within seconds. He had mentioned it casually, assuming it was nothing. It was not nothing. It was his vagus nerve responding to the concentrated acid hitting his empty stomach every morning and sending signals to his heart that were creating brief but real electrical disturbances. I want to be clear that for Raymond, these episodes were not immediately life-threatening at the level we identified them. But in a patient with a more significant cardiac history, the same mechanism can produce consequences that are far more serious. And the frightening reality is that most patients experiencing this would never connect their morning heart flutter to the glass of lemon water they drank 20 minutes earlier, because everything they have ever read tells them that lemon water is heart protective. What the wellness industry is not telling you, I want to take a moment here and speak directly to something that I think needs to be said plainly. The wellness content industry is not primarily in the business of giving you complete, individualized, age-appropriate medical information. It is in the business of producing content that gets shared, content that feels empowering and simple and universally applicable, content that tells you that one easy morning habit will transform your health. Lemon water fits that formula perfectly. It is cheap, it is simple, it feels virtuous, it has enough genuine research behind it to quote convincingly, and the research that shows its specific risks in older adults with declining kidney function and cardiovascular medications is far less exciting and far less shareable than the research showing its benefits. So that research never makes it into the videos, it never makes it into the wellness articles. And people like Raymond, careful, motivated, health-conscious older adults who are trying harder than almost anyone to do the right thing, end up spending a year systematically damaging their kidneys while feeling proud of themselves every single morning. In 10 years of practicing medicine, this is one of the patterns that troubles me most deeply. Not the patients who ignore their health, the patients who pursue it faithfully based on incomplete information and pay a price they never saw coming. You deserve the complete information. That is why I am here. That is why this video exists. What happened to Raymond? I want to finish his story because I think you need to know how it ends. When I explained to Raymond what had been happening, he went through the stages that I have watched many careful older patients go through. First disbelief, then a kind of quiet grief for the habit he had been so proud of, then something that looked like anger, not at me, but at every source that had recommended this to him, without once mentioning what it could do to his kidneys at his age. We built a modified plan together. He stopped the daily concentrated lemon water immediately. We moved to very dilute occasional lemon water, a thin slice in a full glass, a few times per week rather than half a lemon every single morning. We adjusted his medication timing. We scheduled kidney function monitoring every 3 months. Over the following 8 months, his kidney markers stabilized. His eGFR stopped declining. His morning dizziness disappeared. His occasional cardiac flutter resolved. Raymond did not suffer the outcome that Donald did. I am grateful for that every time I think about his case. He came to me before the damage had progressed to the point of no return. But he was shaken. He told me at his 6-month follow-up that he had recommended lemon water to 3 friends after reading about it online. He called all 3 of them the week after our conversation. 2 of them were also over 65. One was on blood pressure medication. You may be that friend right now, the person who needed someone to make this call. Consider this video that call. What you need to do starting tomorrow morning first. If you are over 60 and you drink lemon water daily, particularly concentrated lemon water on an empty stomach, ask your doctor for a full kidney function panel at your next appointment. Ask specifically for creatinine, BUN, and eGFR. These numbers will tell you whether your kidneys are handling the oxalate load efficiently or whether damage has quietly begun. Second, if you take any blood pressure medication, any cardiac medication, or any medication that has ever come with a grapefruit warning, call your doctor's office and ask specifically about citrus interactions with your prescription. This phone call could take 5 minutes and could prevent a dangerous medication accumulation you have no way of feeling. Third, if you love the ritual of a morning drink and you want to keep some version of it, here is what the evidence actually supports for adults over 60. Use a thin slice of lemon rather than half or whole lemon juice. Drink it well diluted in a large full glass of water. Have a small amount of food first rather than consuming it on a completely empty stomach. Do it 3 to 4 times per week rather than every single day without exception. These modifications preserve much of the genuine benefit while dramatically reducing the oxalate load and the vagal stimulation that create risk in aging bodies. Fourth, if you experience morning dizziness, occasional heart fluttering, persistent fatigue, or any discomfort in your lower back near your kidneys, please do not dismiss these as normal aging. They are your body communicating. Tell your doctor specifically and completely. The detail you leave out may be the most important one. The bigger lesson Raymond taught me in 10 years of medicine, I have learned that the most dangerous health mistakes older adults make are almost never the reckless ones. They are the careful ones, the disciplined ones, the ones made by people who wake up every single morning and do something they have decided to do for their health. People who read, people who watch, people who try. The wellness industry reaches these people most effectively because these are the people who are actively looking for guidance, and when that guidance is incomplete, when it tells you the benefits without the risks, when it applies research done on younger, healthier populations to older adults with different biology, different medications, and different organ function, it does not just fail to help, it causes harm. Raymond spent a year proud of a habit that was quietly damaging his kidneys. He was not careless. He was not irresponsible. He was a 68-year-old man doing his best with the information available to him. You now have more complete information than he had. Use it, and please share it, because right now, someone who loves someone you love is squeezing a lemon into a glass of water and feeling proud of themselves, and they deserve to know what you just learned. Before you go, my name is Dr. James Harlow. I have spent 10 years watching patients make well-intentioned choices that cause them harm because nobody gave them the full picture. I built this channel to change that. To give adults over 50 the honest, complete, age-specific health information that short doctor appointments and one-size-fits-all wellness content simply cannot provide. If this video stopped you this morning, if it made you look differently at something you have been doing faithfully for months or years, if it made you think of someone who needs to hear this today, please share this video right now. Before you finish watching, while the thought is fresh, you have no way of knowing how important that single action might turn out to be. Subscribe to this channel. Every week I bring you this kind of honest, specific, research-grounded information for adults over 50. The kind that I believe you deserve and that you are not getting anywhere else. Leave a comment below. Tell me if you have been drinking lemon water every morning. Tell me how long. Tell me if this video changed something for you. I read every single comment, and your experience matters. And like this video, it takes 1 second, and it helps this information reach the people who need it most. People who are doing everything right. People who deserve the complete picture. Raymond's kidneys are stable now. He is doing well. But he wishes someone had shown him this video 14 months ago. Consider yourself 14 months ahead of where he was. This is Dr. James Harlow. Please take care of yourselves. And please take care of each other. I will see you in the next video.